Namaste. I am Dr. Sajit Varghese, consultant physician from Kerala. Today we will have a small academic venture, a discussion for the general public about how to take care of the heart in diabetes. As we all know, diabetes mellitus, it's a pandemic, it's a worldwide disease, it's a lifestyle disease, it's a lifelong disease. So heart diseases remain at the core, that is, it's the main cause of hospitalization and even death in patients with diabetes. People with diabetes are twice as likely to have cardiovascular damage or cardiovascular incidents like heart attack compared to people without diabetes. So let us understand what is the problem behind all these things. So as we all know, diabetes is a non-communicable disease. It's basically the inability of the body to fight against rising blood glucose levels. As we all know, as we start eating or as the food enters our stomach and then gets absorbed into the intestine, the glucose enters into our bloodstream, and it is expected that the pancreas from the body secretes a proper amount of insulin, and this insulin, which is a hormone, it helps in breaking down of the glucose from the blood, and it removes the glucose from the blood, and it shifts them to the cells and tissues which utilize this glucose for energy formation. And this is the natural process which should occur. But in diabetes mellitus, the opposite thing happens. Either the insulin is not formed by pancreas due to one or other reason, or whatever insulin is formed, that is unable to be utilized by the peripheral tissues of the body. So that leads to high blood sugars, what we call diabetes or promeha. So what does this high blood sugar causes? So high blood glucose actually causes lots of damage. There are many mechanisms proposed for this, but in simple words I will explain that they cause damage to the blood vessels, the endothelium of all tissues, and all blood vessels, big and small. It increases the cholesterol levels, that is the bad cholesterol levels, that is what we call the LDL levels, and decreases the HDL levels. And also, with all this damage, the oxidative stress which happens all over the body, the inflammation which keeps on going in all the tissues due to the high blood glucose, what happens is it also leads to hypertension, that is high blood pressure. The blood vessels start narrowing due to this damage, and blood flow has trouble reaching to the different organs of the body, including our heart, including our blood vessels, and that causes cardiovascular damage. Diabetes is a treatable disease, as we all know. Diabetes should be treated, but more importantly, the complications of diabetes can be prevented, or what you call regressed, by following certain precautions. So which are these preventive strategies? Let us discuss. A small synonym or acronym is ABC, that is A stands for A1C test. A1C, also called as HbA1c, is the aggregate of the blood glucose levels over the last 3 months. So HbA1c, when promptly checked along with FBS, that is fasting blood sugars, and PPBS, that is postprandial, that is after food, postprandial blood glucose, PPBG or PPBS, and FBS, PPBS and HbA1c should be regularly tested in patients with diabetes, and increments or decrements of diabetic treatment should be done. That is stands for A for A1c. B stands for blood pressure. Definitely the target for blood pressure in diabetic patients is little lower than in normal non-diabetic patients. Blood pressure is nothing but the force of the blood, that blood column that is exerted in our blood vessels. So blood pressure should be ideally targeted by the range of 130 by 80 millimeter of mercury in diabetic patients. And C stands for cholesterol. Definitely, as I told earlier, the bad cholesterol, that is the LDL, as well as the triglycerides, are increased in quantity, and they start clogging your blood vessels. And HDL, the good cholesterol, decreases in quantity. So this dysregulation, or what we call dyslipidemia, has to be treated, and the patient has to be started timely on hypolipidemic agents. Another thing what we can do is eat healthy and well balanced diet. It is very easy to tell and preach such thing, but very difficult to follow in life. So what we can simply do is avoid or minimize fatty foods. We can change from saturated fats to unsaturated fats. We can avoid refined white breads, wheat or refined wheat breads, cereals, chips and French fries, red meats and processed meats, and sugar sweetened beverages. And what we can do is we can add fiber to our diet, and we can have a lot of whole grain cereals, dairy foods, beans, pulses, lean meats, fish, nuts, and healthy oils like olive oil or at least sunflower oil, right? And we can choose foods which are we can also choose fruits, green leafy vegetables, breads, cereals, and such other changes. And we can also have a dietitian advice for such things. Definitely we have to decrease salt, which is a link between diabetes and hypertension. So salt has to be restricted, and this we can do by decreasing the or by removing the salt shaker which we have on our table, to stop adding the extra salt. And we can have a low salt diet as we grow older. And what more, with the diet comes exercise, and definitely at least 5 days a week workout, or have a dynamic exercise. Dynamic exercise means any aerobics or walking or swimming or cycling, whatever is good and feasible for you, for at least 5 days a week, at least 30 minutes per day. That is what is recommended. And medical treatment for diabetes, yes, those who are diabetic, there is no notion of going to other alternative medications. You have to stick to your medications, stick to your doctor's, physician's advice, and follow the medications, and up titrate or down titrate as is needed with scientific evidence. Lastly, what I can tell is, the main problem with today's lifestyle, since diabetes mellitus is a lifestyle disease, is that we have lots of stress in our lifestyle. We don't care as much as is needed about ourselves. Try to get a good sleep of 7 to 8 hours, and try to reduce your stress. Do relaxation exercises, do yoga, go out with family, or spend time with family, and so on. And these are the simple preventive strategies which can help you decrease your BP, decrease your LDL levels, and finally decrease the complications of diabetes mellitus. Thank you.